For a unique clean air initiative, Doctors for Clean Air is the first of its kind conclave. Doctors across disciplines from all around the world, some 1.5 lakh of them, are coming together to become clean air advocates and start a people's movement for clean air. To tell us more about that, we're joined this morning by Dr. Arvind Kumar, chest surgeon of Gangaram Hospital and founder trustee of the Lung Care Foundation. Dr. Kumar, you have been a clean air crusader and campaigner for many years now, but tell us about this initiative where so many other doctors are coming together. What brought up the idea for this?
So air pollution is a major risk to our current and future generations, and it's a public health emergency where something needs to be done immediately on a major scale to arrest this problem. Otherwise, our future generation will be in grave danger. Now, realizing this, informing people about the grave health ill effects of air pollution and presenting it as a major health issue rather than just an environmental or a chemical issue is the major change in approach towards air pollution which is needed. It's primarily a health issue. And who can be a better person to talk about health ill effects of air pollution than doctors? With that aim in mind, we set up this network of passionate, informed doctors across the country called Doctors for Clean Air, which was launched on December the 4th, 2018. 20 major national medical associations having over 200,000 super specialists have joined hands to, number one, inform them about the health ill effects and then request them to become crusaders to reach this information to people. There's a lot of complex research which is available that needs to be translated into simple to understand messages for the people so that people can realize the grave danger and start taking actions to achieve clean air.
That's a wonderful thought, Dr. Kumar. But would you say that perhaps this year, Delhi, of course, is always in the headlines for the deterioration in its air quality, particularly at this time of the year, the onset of winter, and, when there are farm fires and smog all adding to the crisis. This year, Delhi's actually sort of enjoyed relatively cleaner, better air. Is it still a concern going ahead in the months ahead? What about the rest of the country?
Yeah, so whatever clean air or clean skies, blue skies that we have seen in the last 5-6 months has been the beneficial effect of the lockdown, and therefore hardly any activity, whether it's transport sector or industries. But this is temporary. As the vehicles will come back, as the industries will come back, as our activities will return to normal, air pollution will re-emerge as a major issue. Keeping that in mind, United Nations has declared September 7th as International Clean Air Day for Blue Skies. And the Lung Care Foundation, Doctors for Clean Air, along with 7 major medical associations of the country consisting of gynecologists, pediatricians, cardiologists, chest physicians, neurologists, surgeons, and medical students are meeting together from 11:30 to 6:30, wherein we will discuss in detail about the health ill effects, apprise the information to the doctors, and these doctors will then commit to become clean air champions across the country, thereby starting a people's movement where people will say clean air is a human right and we are willing to pay any price, but clean air is required, is required, is required.
Well, that message can't be stressed soon enough. Dr. Kumar, all the very best to you and indeed all the other doctors who are leading this campaign now from the front. Thank you very much for joining us this morning.